Hello everyone, welcome to my micro teaching video of the neurology part. Today I'll do a quick review of stroke. I'll talk about what is stroke, what's the definition, where it usually happens, and how to prevent it. So the symptoms that we need to know that will be related to stroke, and the two major types of stroke, which are ischemic stroke and hemorrhagic stroke. So having a stroke is just as serious as having a heart attack. It is important to know the signs of stroke and act quickly if you suspect you or someone you know is having stroke. Stroke risk increase with age, but strokes can and do occur at any age. The good news is that most strokes can be prevented, and there are steps you can take that may lower your chance of having a stroke. We always need to remember to call 911 right away if you or someone you know has any of these symptoms. They will be like the sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, and people having sudden confusion, trouble speaking or understanding speech, or people having sudden problems seeing in one eye or both eyes, and sudden dizziness, loss of balance or coordination, or trouble walking, and sudden severe headache with no known cause. And other danger signs that may occur include double vision, drowsiness, and nausea and vomiting. A stroke strikes fast, and responding quickly when you notice any of these symptoms is key. And also remember, when don't to drive yourself to the hospital, and don't ask someone else to drive you. Call 911 right away for an ambulance so that medical personnel can begin life-saving treatment on the way to the emergency room. And we can remember there's an easy way to remember is acting fast. FAST is the key to stroke survival, which means fast. F stands for the face. So we can ask ourselves or our friend, does one side of the face droop when smiling? It's not very bilateral. And A stands for arms. Like, does one arm drift downward, or when both arms are raised, not very balanced. And S stands for speech. So is speech slurred or strangled when repeating a simple phrase. And T means time. So if you see any of the signs, call 911 right away, and put a note on a sticky or on the iPhone for the exact accurate starting time or the examining time. And the stroke happens when there's a change in low blood flows through the brain tissue. So the blood bring oxygen and nutrients to brain cells. So if blood can't flow to part of the brain, the cells that do not receive enough oxygen suffer and eventually die. So if brain cells are without oxygen for only a short time, like a few minutes, a few hours, they can sometimes repair themselves. However, once brain cells die, they can't be prepared. They can't be repaired. While there's a growing evidence that in some cases, new brain cells help to replace those lost, this takes time and occurs much more slowly in older adults. And as a result, someone who has had a stroke may have trouble speaking, thinking, or walking. And next, we're going to talk about the two major types of strokes. They are the first, ischemic stroke. This is the most common stroke and happens when a blood clot or the narrowing of a blood vessel, usually it's artery, reduces blood flow to the brain. This keeps blood flow from flowing into other parts of the brain, and stops oxygen and nutrients from reaching brain cells. Ischemic strokes are commonly caused by thrombosis, embolism, and stenosis. And then the other type is called hemorrhagic stroke. Literally means bleeding stroke. The second major kind of stroke is marked by a burst of blood vessel that causes blood to leak into or around the brain tissue. This breaks reduce the delivery of oxygen and nutrients to brain cells and expose the brain tissue to toxic substances that may cause the cell to die. The bleeding also increases pressure inside the skull that they compress the brain tissue and cause damage. The earlier someone with stroke arrives at the hospital, the more likely they are to receive effective treatment. So don't delay if you or someone you know experiences any symptoms. 这个中风呢，它是和心脏病发作是一样严重的，因此也就是说，了解这个中风的迹象是非常重要。如果您怀疑自己或者您的家人患有中风，请迅速的采取行动。中风的风险呢，它是随着年龄的增长而增加的，但中风呢也可以，而且确实呢发生在任何的年龄。好消息是说，大多数中风是可以预防的，您可以采取一些措施来降低发生中风的风险。如果您或您认识的人出现以下的症状，这个症状很重要哈，就是请立即致电这个911急救电话。包括呢就是面部和手臂的或者腿部的突然麻木或无力，尤其是发生在身体的一侧，还有突然的意识混乱，说话很困难，讲话很困难，或者是难以理解言语，他听不懂。还有在视力方面呢，是一只眼睛或者是2只眼睛突然出现这种视力的问题，看不清楚东西，眼睛突然就是视野突然黑掉，或者突然的头晕，失去平衡，或者是协调行走比较困难。还有就是不明原因的突然的剧烈的头痛。其他呢可能出现的危险包括复视，就眼睛看东西是重影的嗜睡，总是睡不醒，恶心或者呕吐。中风呢发作的很快，当您发现有任何的这些症状的时候，应该迅速的做出反应，是非常关键的。还要记住一点，就是自己不要开车去医院，也不要让别人开车载您去医院，马上要拨打911这个呼叫电话，呼叫救护车，以便这个医务人员呢在前往急诊室的过程中开始一些急救的一些措施。有一个很好记的一个归纳中风症状的词语叫 FAST F-A-S-T。 F 指的是面部 face， 然后 A 指的是 arm， 是肢体或者是手臂， S 指的是 speech， 也就是言语出现了问题，然后 T 指的是 time。 我们要牢记就是出现这个问题的时间，发作的时间，还有就是时间抢救时间也很关键，如果出现这些问题的话，及时要就医。下面我们来讲一下就是中风发作的一些原理。就是当这个血液流经大脑的方式发生变化的时候呢，就会发生中风。血液呢是为脑细胞带来氧气和营养的。如果血液无法流向大脑的某个部分，没有足够氧气和营养的支持，这部分脑组织就会受到影响，最终死亡。如果脑细胞呢就是短时间的缺氧缺营养，它们有可能会自我修复，但是脑细胞一旦死亡呢，它其实是这个过程是不可逆的。尽管呢就是越来越多的证据可以表明，在某些情况下，这个新的脑细胞可以有助于替代丢失的死掉的脑细胞，但这还是需要时间的，而且在老年人中呢发生的速度要慢得多。所以因此呢，中风的人可能会出现讲话思考或者行走的困难，这是一个终生的后遗症。中风主要有2种类型，一种叫做缺血性中风，这个是比较常见的中风，它就是由血栓或者动脉的这个狭窄变窄，血流变窄造成的。这个血液流经的这个血管减少流量之后，它会经过的这个大脑组织就会缺营养缺氧气，这些营养物质不能够到达脑细胞的话， 那这部分脑组织就会死亡。那么缺血性中风呢，通常是由以下原因引起，那就是比如说血栓啊、栓塞啊，还有血管的狭窄。第二种呢叫做出血性的中风，这种情况呢没有缺血性中风的概率大，但是也是比较常见的。它的特点就是血管是破裂的，导致这个血液呢从血管里面渗入到脑组织中。这种呢，这个血流中断，这种血流的渗入呢，会中断这个脑组织供血供氧，所以说也会导致脑组织的死亡，它会释放出一些有毒物质。这个出血还有跟缺血性中风的不同的一点是，它会增加颅内压，增加颅骨内的压力，从而它压迫脑组织，并且对脑组织造成损伤。中风患者呢，越早达到医院，他们就越有可能接受到有效的治疗。如果您或您认识的人呢，出现任何有关中风的症状，请不要拖延，及时就医。